Excellencies, invited special guests, and honorable audience, Namaste. It's my great privilege and honor to speak to this august audience. And the theme today I would like to talk about is the role of traditional systems of health knowledge in contributing towards health and wellness of the society. Health for all and health and well-being by 2030 is an international goal accepted by the UN General Assembly. So we have a national commitment and a global agreement that the state and the people will work towards ensuring health and well-being of all in the broader context of leaving no one behind the benefit of development. Today, when you talk about health, one of the most important aspects you have to remember, the key determinants of health are often outside the hospital. When you talk about health, the main image comes of the specialized large hospital. But today, there is a greater understanding about social and structural determinants of health. The factors contributing towards health and wellness is equally important, like our scientific knowledge about managing and treating complex and recurring illness like COVID pandemic. In this context, I would like to highlight few of the issues about how the traditional systems of medicine fit into this, our idea of health and wellness. In parallel to the what we traditionally call as modern medicine or allopathic medicine, in the Indian context, we have Ayush, Ayurveda, Unani, homeopathy. So that itself as a counter to or parallel to the modern system of medicine is accepted by the government. But interestingly, beyond Ayush, also there are traditional knowledge systems about health and wellness. In the context of Kerala, what we call it as Paramparagata Vaidyam or Paramparagata Vaidya Prayogangal. So that is becoming an important area of where the public, the health seeking behavior, if you look at carefully, many people believe and trust the traditional systems of medicine. And in that context, state has a responsibility to look at the scientific aspects of this system of knowledge. Like any other systems of knowledge or body of knowledge, all systems and all body of knowledge should be constantly reviewed in its relevance, in its scientific authenticity, and its overall contribution to science and society and the well-being. In that context, I would say that the state should take a particular role in understanding what is the scope of traditional medicines and what is the contribution towards health and wellness for society in general. So if you look at again in the global context, WHO has commissioned a study on what is the role of traditional systems of medicine in the global context. And it is discovered that there are traditional systems of medicine practiced in almost all parts of the world. There are Chinese systems of medicine, there are Japanese traditional system of medicine, there are Korean traditional system of medicine, there are Latin American system of medicine, and many of the African countries, there are African system of medicine. So we need to look at what is the scope of understanding this body of knowledge about health and well-being, how we integrate that into our primary healthcare framework. So this is one of the important responsibility of the state. We should not completely ignore this body of knowledge, because this body of knowledge has at least a workable hypothesis to show that this contributes towards health and well-being. But it's the responsibility of state again to validate these claims, validate this body of knowledge to the modern scientific frame of reference. So in this context, again, I would like to say that the traditional system of medicine, which are beyond the Ayush system, itself is very complex and very comprehensive in many areas of the operation. And again, I would emphasize the role of state government in the Indian federal system, because health is considered as a state subject, whereas the federal government also taking many efforts to integrate or give direction in the area of how to deal with the health and wellness. So increasingly health is considered as both the traditions, both in the state as well as the federal government, what we call it as a concurrent system. Even in the federal system, health is a state subject, but increasingly health is practiced in the concurrent system. That way, I would say that both state government as the national government has a responsibility to provide a framework to look at the effectiveness, look at the contribution of traditional systems of medicine beyond what we call it as Ayush systems of medicine. And to take this forward, I would suggest that the state government and the national government, they might commission a comprehensive review, a study on the state of play of the traditional system of medicine in India. And different states has got a different practice and different regulatory mechanism, and probably in the national level there should be a robust regulatory mechanism which look at the training pattern of traditional system of medicine, the quality assurance, the research required to taking this forward, and also ensuring the body of knowledge which is represented in the traditional system of medicine are validated in the scientific frame of reference, and also to look at that how this traditional system of knowledge could be integrated into the national well-being. So these are some of the areas which require immediate attention. I hope this August gathering may take a note of this important aspect of the role of traditional system of medicine. In nutshell, I would suggest some of the recommendations. Number one, the state government and the national government should immediately commission a study on the scope and the role of traditional system of medicine which are beyond the scope of Ayush medicine. Second, they have to think about a national act or a state act to regulate and control, manage and promote traditional system of medicine. And third, there is also need for looking at the training component of traditional system of medicine, what they call it as from generation to generation, this is studied to generational transfer of knowledge, and what we call it is in probably what we can call it as an apprentice system of learning. And this need to be looked at carefully and brought up into some framework of minimum quality assurance of this apprentice model of traditional system of medicine training. And I would also like to acknowledge Government of India's initiative for sponsoring and hosting an international center for traditional system of medicine in Gujarat. And probably that center should be operational. That is still in the initial infant stages of that. And that's the WHO's International Center for Study on Traditional System of Medicine should also look into the possibility of integrating traditional systems which are beyond the scope of Ayush to integrate into the main system, and also to create in the nomenclature, and also the disease classification also should take into consideration of the disease as it is classified in the traditional system of medicine. And in nutshell, I would conclude saying that the body of knowledge which is represented through traditional system of knowledge need to be acknowledged, need to be regulated, need to be further taken forward. And whatever regulatory mechanism required to take it forward should be initiated and implemented by both state and the central government. And also I would suggest that there are more than 1,000, in the case of Kerala, there are more than 1,000 practicing traditional medical practitioners in Kerala. And in the broader sense, there is a concept called the multiplicity of health systems, or what we call it as the health system diversity. That means acknowledging the presence and practice of different systems of medicine. So that should be integrated into the national and state health policies, and resource allocation should be made to ensure that traditional systems of medicine which are regulated, which are ensured, quality assured, are regulated into primary health care and the scope of primary health care, and that will be a justice to the thousands of people utilizing traditional system of medicine as their primary health care. This also in the context of out-of-pocket expenditure is going beyond the manageable limit of many of the people, and also access to healthcare is pushing people into catastrophic health expenditure and pushing below poverty line. So in nutshell, the government should acknowledge the contribution of traditional system of medicine that should be regulated, and also the multiplicity of medical practice, health practice should be acknowledged, and the appropriate regulatory systems are in place. And I conclude congratulating the organizers of this conference and bringing this issue forward. Thank you very much.